Oh, they're kissing.
That's what.
funny.
Oh. Yeah.
Oh,
They
so
love each
cute.
other.
Oh, wow.
So I'm gonna.
So this is a sight question.
Darling, I want to. Let's wait until she comes in.
Okay.
Because the funny thing is for you to know how to read your questions.
Mm-hmm.
If you know how to read it to understand the question, you should be able to find any answer, even.
Yeah, she didn't check out.
Okay, forget it. So let me read it first. During the assessment of a client with panic disorder in an outpatient setting, the nurse conducts a comprehensive health history and physical examination, which assessment finding will be the most critical for this client. So I want you to read it so she can pick up what she needs to underline, okay? Go ahead and read it.
In the assessment of client with panic disorder in an outpatient setting, the nurse conducts a comprehensive health history and physical examination. Which assessment finding would be most critical for this client? Okay. A. Compulsive disorder. B.
You didn't see compulsive, no? You didn't see that. Read the question, read it. A, that's not what you see, my love.
A. It says compulsive behavior. Oh,
Ah.
behavior. Yeah.
Mm-hmm.
A. Compulsive behavior. B. Sense of impending doom. C. Fear of flying. D. Predictable episodes.
So, what would you underline the list? Debbie?
I miss panic disorder.
And what else?
Outpatient setting. Comprehensive and physical exam. And critical for the
No, most is the key word. Most, because they know everything is critical, but they want to know the most. So let me read it for you. During the assessment of a client with panic disorder and in an outpatient setting, the nurse conducts a comprehensive health history and physical examinations, which assessment finding will be the most critical for this client. A. Compulsive behavior. B. Sense of impending doom. C. Fear of flying. D. Predictable episode. What will be your answer? A. Debbie, your answer, please.
B.
What is your answer, please?
I pick B.
Okay, so now, when you pick B, I want you to do your do's and diligence. Impending doom. What is impending doom?
Impending doom is like a fear that just comes suddenly.
Okay, what is the fear of impending doom, Debbie? Impending doom is the fear of the unknown. I know something is bothering me, but I don't know what it is. I know I feel anxious, but what caused it, I don't know. This is impending doom. Impending doom is the fear of the unknown. This is what impending. Now I want you to look up impending doom. You hear me?
Yes.
The best explanation for impending doom is the fear of the unknown.
Impending.
It's the fear of the unknown.
Careful, feeling of the dread that something bad is about.
Darlene, you gotta read slow. You gotta be firm when you read. The way you're reading, you're not gonna catch anything. Read okay, what did you put to begin with? Impending doom what? Impending doom what? NCLEX. So you gotta put impending doom NCLEX so you could know what they're talking about. What is it? I show you how to look it up. Darling, let me see your phone. You see, you're not gonna read from there. You're gonna go up This is your impending doom. Okay. You gotta show more. I don't know what you put behind yours, but okay, read the What is impending doom? Impending doom is the fear of the unknown. Impending doom is the fear of not knowing what the judge is gonna say.
Okay. I don't know why my
Okay. Find out, darling. Let's go. Debbie, what is impending doom, please?
This is severe anxiety.
Okay, it's an anxiety, it's the fear of the unknown. Anxiety is the fear of the unknown.
Okay.
I know I didn't pay my rent. I know there's a possibility they're gonna throw me out, but I don't know what the judge gonna say. This is impending doom. It's the fear of the unknown. So now, read the question again. Based on that explanation, further answer, the answer is B. Sense of impending doom. If it's the sense of impending doom, it could be for the nurse, it could also be for the clients. Read it again.
During the assessment of a client with panic disorder in an outpatient setting, the nurse conducts a
You read too fast, darling. Too fast. You're not going to digest it. Unless the only way somebody who reads fast going to digest is someone that habit is reading. If your habit isn't reading, you're not going to learn anything. Let's go.
Okay. During the assessment of a client with panic disorder in an outpatient setting, the nurse conducts a comprehensive health history and physical examination. Which assessment finding would be most critical for this client? So, A, compulsive behavior. B, sense of...
Why is that compulsive behavior? Why? Did they tell you in the question that the patient was moving back and forth? Did they tell you that the patient was, moving back and forth? The patient was all over the place? They didn't tell you that. So compulsive, now I want you to look up compulsive disorder. Compulsive behavior. That's the way you study. Damn, I'm fucking tired. Damn, I need to sleep.
Oh, man.
Okay, what is compulsive disorder?
Behavior.
Darling, compulsive disorder what? You gotta look compulsive disorder in class.
Anntwip.
What did you find, Debbie?
Compulsive disorder.
Louder, darling.
Behavior.
This is compulsive disorder, particularly focused on managing anxiety, allowing limited time for...
Darling, you go too far. Compulsive disorder is an anxiety you cannot control. You go back and put compulsive disorder in class, my love. You cannot control it. What did you find?
Says repetitive.
Repetitive. That means I'm touching the door. I don't want to touch the door. I go back in the door. I don't want to open the door. That's compulsive disorder. Keep reading your stuff.
Actions in obsessive compulsive disorder performed to reduce the anxiety caused by intrusive, unwanted thoughts called obsession.
Obsession. Guess what? Compulsive disorder is when I goes into my fridge, I open the door, fridge, I close it, I open it again. Because I think by opening the fridge, I'm going to solve my problem. Which is because it's a compulsive disorder, I'm doing it to reduce my anxiety. But in general, the anxiety is not reducing. So now go back and put a note about your sense of impending doom. Go in the
I can write on here?
yeah, that's yours. Impending doom. Next to impending doom, put a tiret. Qui monte les Debbie pour la petite la mienne là? Ouais, Debbie ça. Impending doom. Hello, darling, listen to this. Impending doom is the fear of the unknown. I am stressed. I don't know if I'm not going to be able to pay my house. I don't know if the judge is not gonna throw me in jail. That's impending doom, the fear of the unknown. Now, compulsive disorder or compulsive behavior is a behavior that I'm using. I know I'm stressed. I know my anxiety level is high. Hello. I'm going to the fridge back and forth, thinking by opening that fridge door, I'm going to lower my anxiety, which is not true. It's in my mind. Hello. Next. Now, this is the way you do questions. You got to question every answer.
Okay.
If you don't question every answer, if you find the same question on a different level in the exam, you're not going to be able to answer it correctly. Fear of flying. Go back. Read the question again. C is fear of flying. Shut up, motherfucker. Fear of. Go read the question one more time. I'm going to show you how to read your question. Let me read it for you. I want you to pay attention and listen. That's the way you need to read it to yourself. During the assessment of a client with panic disorder in an outpatient setting, they told you where the patient is at. The patient is in an outsetting patient setting, not in the ER, not inside, in a clinic. The nurse conduct a comprehensive health history and physical examinations, which assessment finding will be the most critical for this client. So now, in this question, you gotta ask yourself, C is fear of flying. Did they address flying there? No. Did they tell you the patient is gonna get on an airplane? No! That would be a no. I'm not going to address that because the question did not address fear of flying. You understand, Debbie? Femme Debbie, vas Debbie là. Hey, Debbie. Debbie, vous parlez pour nous qu'on en fait moi. Okay, so now, fear of flying, I will put next to it out of the questions. The reason is not, they don't address that in the question. Did they tell you in the question the patient have problem flying? No. The patient is vomiting when he fly, the patient is scared? There's no such thing. So, fear of flying is not there. So now, predictable episode. Now read it. Read the question again, darling.
During the assessment of a client with panic disorder in an outpatient setting, the nurse conducts a comprehensive health history and physical examination. Which assessment finding will be most critical for this client?
So now, now I want you to go back to the question and ask yourself, what did the Board of Nursing is asking me? The question only. Translate the question to our own understanding. What do you think they're telling you? In your own words.
Which is the most important?
In your own words. Before you even go there, what the situation?
You're saying that there's a client
do not look at the question. You got to be able to process it and put it in your own words.
There's a client who has a panic disorder in the clinic, and they want to know which of the findings.
I want you to go back next to panic disorder. I want you to look up panic disorder NCLEX. So now you know what this panic disorder is for.
Yes.
Keep on saying yes. So, yes.
Do it after work.
Okay.
I'll work at post office after.
Okay, what is panic disorder? Panic disorder NCLEX, please. What is it?
Panic disorder involves recurrent, unexpected panic attacks characterized by sudden, intense fear with physical symptoms like palpitations.
Stop. So now we learn panic disorder is an unwanted feeling. So how does panic disorder manifest? It manifests physically. The patient will have anxiety. And the patient will have palpitation because I'm panicking. Somebody's running after me. I don't know what is next. Read it again.
For the NCLEX, panic disorder involves recurrent, unexpected panic attacks.
That's something when your panic disorder is come out of nowhere. The patient don't have to have any reason. They're just panicking. It's a fear of the unknown, but guess what? It's anxiety.
Yes.
And then gets sudden,
intense fear with physical symptoms.
Okay. Moun having the intense fears. Your peur, your baga you back on peur. Physical symptoms, palpitation, sweating, what else? Shaking because I'm scared. I'm shaking. I'm sweating.
Shortness of breath.
Somebody's running behind you. Now put it on your own word. Panic disorder is an intense feeling. It's an anxiety feeling. It's intense. The fear of the unknown. Physically, it acts on me. I'm having shortness of breath, palpitation, anxiety, and I'm scared. I'm sweating. I'm scared. I'm sweating. That's panic disorder. Do you see how many things you learn in this one question?
Yes.
Okay, so now.
Okay. Wow, that was a lot in this question.
One question, you got to learn every wrong answer. Because every answer, you have to go back to the question. They didn't address fear of flying. Nobody was flying to California or Bodega, whatever. So I'm going to eliminate that.
Yes.
Sense of impending doom, because the patient has panic disorder. What is panic disorder? The fear of the unknown, anxiety, palpitation, shortness of breath, sweating. So now impending doom is the same symptoms.
Okay. Yeah.
So if it's the same symptoms, I'm gonna wait and see what is compulsive behavior. Did they tell you this patient was opening a fridge door or opening the door, close the door, the patient? No, there's no compulsive behavior. They didn't tell you the patient was walking back and forth and sit on a chair. That means when the patient keep on going back and forth, sitting on the same chair, they're looking for compensation. You don't have that in your question.
No.
Next.
Predictable episodes.
What predictable episode? Read the question. Did they ask anything about, did they told you there was an episode before?
No.
What episode they tell you? So you need to eliminate that answer. Because there's no, read the question and figure it out.
During the assessment of a client.
Darlene, lo ap li, si ou gen si moun gen marou, al non shampoo pour li, pour tan de tête ou. Parce que c'est un examen besoin passer. Ou pas pral li, non. On va dire comme ça que durant the assessment of a client with panic disorder, and in an outpatient setting that the patient is not in the hospital, the nurse conduct a comprehensive health history. I need to comprehend what's going on. And physical examination, I need to see what's going on with you. Are you sweating? Are you yelling? Are you screaming? Are you combative? Okay? So, which assessment finding will be the most critical for this client? Depending on, because we don't have anything else to go, we know this patient go crazy in a minute. Okay? Remember, your answer must be in the question. Okay. If they don't address the answer in the question, it's not an answer. Okay. Next.
Alright. A newly...
Darlene, make emotion soon. Go on Zoom.
A newly... What? I'm sorry. I didn't hear what you said. Did you say something, Debbie?
No, I said that's question number 2, right?
Yeah, this is question number 2.
Okay.
Alright. A newly admitted client is diagnosed with portal hypertension.
I'm going to stop you right there. Read again.
A newly admitted client.
I'm going to stop you right there. What words you want to underline?
Newly.
Newly mean what? That's something new for the patient. They just admit the patient. It's new. What come with new?
the
teaching, because the patient never had that kind of diagnosis. I need to teach. Read again.
a newly admitted client is diagnosed with portal hypertension.
Now I want you to tell me what is portal hypertension. You got to look it up. Portal hypertension in class. What was the house imagine Oh, il vient de jeter de l'eau. Oh, il a jeté manger l'eau. C'est ça que perd là, mon gars. Là, il manger.
Okay.
Il a jeté manger. Okay, so now you gotta look what is portal hypertension.
Southern NCLEX portal hypertension is characterized by high pressure in the portal vein.
Okay, that's all you need to know. You're not a doctor. Portal hypertension is high pressure in the portal vein. Now you want to know where is the portal vein. Je te manger à bien, bonhomme. That's the way you spell it, okay? Agora eu estou a pedir de magia. Bia bonhomme. Baba no manger um pouquinho, que vem down.
Okay.
Okay, what is portal hypertension?
Hypertension in the
Portal
vein.
hypertension. It's not hypertension. Portal.
High pressure in the portal vein.
What is it?
High pressure in the portal vein.
Okay, so now, what is the normal for someone who have portal hypertension? You need to know that. Normal, because keep on reading it first. That's the way to study.
Characterized by high pressure in the portal vein, leading to complications like ascites.
That's it. So I know now, portal hypertension causes ascites. Put it. I know portal hypertension causes ascites. It's pressure in the portal vein. And it causes ascites. Now you want to know where is the portal vein. If it causes ascites, what do you think is affected? Go look. Now you keep on reading.
Leading to complications like ascites, abdominal fluid. That's what ascites is.
Ascites is accumulation of abdominal fluids in your abdominal cavities. Okay? It goes on.
Esophageal varices, swollen veins.
Stop.
That can
Right there. We're talking about portal vein now. Go back.
Mm-hmm.
Now put your phone down. Portal hypertension is what?
High pressure in the
Portal vein. So now, if we have high pressure in the portal vein, it will cause ascites, which is accumulation of fluids in your abdominal cavities. Now you want to know the cause. What do you have to say, Debbie? Anything new?
I'm listening.
Like ascites, abdominal fluid. Esophageal varices, swollen veins that can bleed, and hepatic encephalopathy, confusion from waste buildup. So those are the complications of.
Darlene, read it again because you're off.
Okay. Portal hypertension is characterized by high pressure in the portal vein, leading to complications like ascites, abdominal fluid, esophageal varices.
That's it. You got to keep on going.
Swollen veins that can bleed, and hepatic encephalopathy, confusion from waste buildup.
Stop it. Now, stop it. Don't look at your phone anymore. I'm going to explain to you in a simple words. Portal hypertension is the portal vein that's, listen, do not just, portal hypertension is the portal vein that occluded. So, If the portal vein is occluded, it causes buildup of fluids in your abdomen that cause ascites, and also it affect the varicose vein, could lead to bleeding and will cause encephalopathy. When you have encephalopathy, that's when you have buildup of waste that cause confusion. The patient will come altered mental status. So now I want you to look up encephalopathy. Okay? You got it, Debbie?
Yes, I'm here. Yes.
I didn't ask you if you're here. I'm asking you if you get it.
Yes, I do.
Okay, so now this is how you study. That's the reason when somebody said they do 20 questions a day. If you don't know your staff, you cannot do 20 questions a day. Okay? You gotta understand the questions. So now we know portal hypertension is the portal vein that occlude, that cause a backup. And the backup cause fluids in the abdominal cavity that cause ascites. Ascites is accumulation of fluid in your abdominal cavity that cause your abdominal girth. It's most of the patient who have ascites, they will tell you, oh nurse, my dress don't fit anymore. When I, up there is good. When I get to my abdomen and the waist, it doesn't fit. It's because your abdominal girth is becoming large. You accumulated fluids, you retaining fluids. Let's go.
Okay. A general term for any brain dysfunction with an altered mental status being the hallmark symptom. Understand and
Stop right there. So if somebody has portal hypertension and the patient come into the hospital, if you retaining fluids in your abdominal cavity, what do you think will happen to the patient? What do you have here? Yeah, of course, shortness of breath. Because your diaphragm will force to go up. Your diaphragm will not have enough room to extend, to promote gas exchange, good gas exchange. So the doctor at this point have to make a decision. He has to say, you know what? Since the patient has so much fluids, I need to drain the fluids. It's either you use lasers. If lasers don't work, he's going to have to do a paracentesis. He has no other choice. Okay. Keep on going.
Key nursing considerations involve safety. Due to the confusion and altered...
What is the safety? If the patient's portal, listen to this carefully. Portal hypertension, there's an occlusion in the portal vein. So that means if there's an occlusion, there's buildup of fluids in the abdominal cavity that cause ascites. If there's ascites, we build up waste. And the waste, what type of waste you think you build up? Ammonia. The patient becomes altered. That's the reason they need to do an ammonia level. When my patient was talking to me, I'll let them know and now my patient is telling me, oh, I remember the saline. The saline is no longer here. So I know you altered. I know to ask the doctor to do an ammonia level. That means you build up ammonia that causes confusions. It's a waste of the byproducts, 14 byproducts, ammonia. Okay. Let's go.
So key nursing considerations involve safety.
What is the safety you want to do now? Put your phone down. If somebody is confused, what's your safety?
You're going to do the paracentesis.
Darling, you're not a doctor. What is your safety as a nurse? The bed in lower positions. Make sure there's a one-to-one at the bedside. Make sure the doctor is aware. The doctor gonna order what medication? KH to get rid of the ammonia. They could give it PO, they could give it rectally. They could give it PO and rectally. Rectally is like they use it as an
like the
they use it. They use it as a, what do you call that? Enema. They use it as an enema. Enema. So, sexy, I want to make sure the bed is in the right positions. I want to make sure there's a nurse at the bedside. I want to make sure the doctor is aware because my patient is confusing. My patient will not be staying in the bed. Paracentesis is not your fault, it's the doctor's fault.
Okay.
Anything you're not allowed to do, that's not your fault. Your job as a nurse is to report to the doctor, and your job is to protect the patient. You don't want the patient to break their neck, break their head. You're going to be responsible. The doctor will say, oh, no one told me. And you're on. Let's go.
Okay. Question.
Continue on reading, darling. They told you about safety. Now you know they're going to become confused. And what else you want to do? This patient, hold on. This patient, the portal hypertension, you know, it could lead to ascites. Your job is to correct that before it leads to that ascites. So if you then correct it, it lead to ascites, your job is to measure the abdominal girth every morning. What time?
Before breakfast.
Yes.
6 a.m.
6 a.m.
The board of nursing said it's 6 a.m. before breakfast and before what?
No.
Before they even lunch.
Oh.
Before they even brush their teeth.
Okay, so 6 a.m. before they go.
Darling, let me tell you the reason they said it's not just know the time. You need to know why. The reason they said is when the patient get up, remember they don't do any activities yet. You want to make sure that that portal vein was at rest. If the portal vein is fully blocked or not. So you want to do it 6 a.m. before they brush their teeth. And then you want to also do it before breakfast. The board of nursing will treat you. You go with on the test, before breakfast. And then what happened to you if you don't see before breakfast? It's 6 a.m. If you don't see 6 a.m. before they brush their teeth, that means as they wake up in the morning. Okay? Let's go.
So which nursing diagnosis should be considered the highest priority when planning care?
It's not sexy? What is it? Keep on reading. Keep on reading, darling.
A. Altered.
Darling, please, you are reading there.
Okay. Key nursing consideration. Safety due to the confusion and altered.
When a patient is confused, what do you think happened to the patient? The patient is prone to break their necks. They're prone to just kill themselves by accident. They could, So safety is your priority.
Yeah. Managing specific causes like hepatic encephalopathy, ammonia buildup.
Hepatic encephalopathy. What is hepatic? It's not your liver? Yeah. Hepatic? Go look it up, darling. Don't say yeah. Look it up. Because as a nurse, you must be intelligent, well educated, and well knowledgeable. That's what makes doctors respect you. Administration beg you because you're knowledgeable. Okay, Debbie, what is
hepatic encephalopathy?
Debbie, what is hepatic encephalopathy?
Okay, hepatic is a complication of liver dysfunction.
That's it. Stop right there. When you say hepatic, it's liver. You don't give a fuck. You just want to know now what the liver put.
Okay, liver.
What is the liver produce? I want you guys to take notes. The liver is responsible for your clotting factor, no?
Liver.
Yes.
1, responsible for your clotting factor. How? You gotta know how. Okay, so read it first before you write.
It says, involves understanding that the liver does the signs and symptoms of liver dysfunction and associated lab values in nursing interventions. Key areas include recognizing that liver damage.
Please. You're in the wrong spot. Liver is responsible for your clotting factors.
I got it here.
Is also responsible for filtrations.
So detoxification.
And is very detoxification and it is very vascular. So if you somebody read about what the liver is responsible for.
Detoxification. Filters and remove toxins.
Yeah. Stop there. If the liver is responsible for detoxification, you gotta put it here. 1. Liver is responsible for 1, your clotting factors. 2, your detoxification, and what else?
Metabolism.
Of what?
Nutrients.
What kind of nutrients, darling?
Ammonia.
Stop it now. I want you to read it again. Do not copy like this. I want you to digest it or you read it. Let's go. Oh, this bird. I want to kill them. Okay, darling, Debbie, are you gonna read it to us first? What is the liver? The liver has 3 functions. It doesn't have meat and it doesn't have 4 parts. 3. The liver is responsible for what? Detoxification? Metabolism of what? 2, metabolism of what? Vitamin? What? Ay. That means the liver is responsible for the detoxification, metabolism of glucose, and the 3rd one is what? Filtration, no? The liver is not responsible for filtration, no?
Yes.
Okay, filtration of what? Darling, read it again, okay? Read it.
It says bioproduction.
Darling, read it. Do not write things that you don't understand, okay?
Synthesis produces vital proteins like albumin and clotting factors.
So now, you gotta put the liver as responsible for producing albumin and clotting factors. Albumin, what is albumin is for? Albumin, for you to know if somebody is eating well, is the albumin level you need to look up. Usually elderly, the albumin are low because the elderly, they have financial problem or they don't have no family around to cook for them, they depressed. What is the normal albumin? So now you know the liver is responsible for detoxification. The liver also regulates glucose, and also the liver control albumin. So do not, darling, I don't want you to write until you understand it. Read it for yourself.
Synthesis produces vital.
Darling, we read all over, okay?
Okay.
Please.
Key liver functions. Detoxification. Filters and remove.
Darling, you go too fast. Key liver function 1, detoxification.
Okay.
That's the way to learn, okay?
Okay. Key liver functions. 1, detoxification. Filters and removes toxins from the blood.
Stop it right there. So that means they tell you he does filtration. How? By removing toxin from the blood. Liver, detoxification, put in parentheses, remove toxin from the blood.
Okay. Metabolism. Processes drugs and nutrients, including converting ammonia to urea.
Stop it right there. So now, hello? The liver metabolizes drugs and nutrients. By doing that, it converts ammonia to what?
Urea.
It's very important. So how are you going to put it in your own words? I don't want you to copy this. Darling, you got to learn it now. You just learn it and done. How are you going to put it? So the liver is responsible for detoxification by
converting ammonia to urea.
So if the liver is damaged, the ammonia level will be
high.
And guess what's going to happen to the patient? Confused.
There's mental status.
Yes, confused. Darling, too much words for you. You're not a doctor. The patient going to be confused because ammonia, high ammonia cause confusions.
Okay.
What is the normal ammonia level? Please look it up. What is the normal ammonia level? So you see in one questions how many things you learn?
Yes.
Okay, that's the way to do question.
Okay. Normal ammonia level 19 to 60.
Darling, do you put NCLEX? I don't think so.
Wait, or
Did you put NCLEX behind it?
Yes.
Okay, what is the normal for you?
It says 11 to 35.
What is the normal ammonia level for you, Debbie?
19 to 20, MCG.
How much?
19 to 60,
MCG.
Oh, okay, I see MCG.
You gotta put the MCG because the board of nursing will put MJ.
Oh, okay.
And then guess what? You choose MJ, you're in trouble. So yeah, put it in your book.
Ammonia.
Okay.
To 60 MCG.
So now, I want everybody to take a deep breath. Debbie, based on all you learn, only you're gonna read in your Anntwip woman. Now I'm gonna read the question to you. You tell me what's your answer based on all you learn. Let me read it. A newly admitted client is diagnosed with portal hypertension, which nursing diagnosis will be considered the highest priority when planning care. A. Altered nutrition less than body requirement. B. Potential complication, which is hemorrhage. C. Ineffective individual coping. D. Fluids volume excess. Can I help you or what? Debbie?
Yes.
What's your answer?
B.
Based on what?
Everything I've learned.
Based on what? Fuck you. Based on what? What is your, hold on, stay. Keep your answer. What is your answer?
My answer is D.
Okay. You said your answer is B? I agree. Because the liver have the clotting factor.
Okay.
If the liver have a problem, you're going to bleed to death.
Okay.
You damn right,
Oh,
Debbie.
bro, Debbie.
You're
good
damn
job.
right. She just don't know how to explain it.
I just couldn't.
Yeah, she cannot explain it. Let me tell you, if you do those booklets the way I'm showing you guys to do it, you should have no problem on the bottom. Nothing.
Oh my goodness.
Yeah, so altered nutrition. End the question. Did they talk about nutrition? Okay, you said Z, fluid volume. Go back to the question. Show me where they address fluid volume.
Nowhere.
I'm going to read it again. A newly admitted client is diagnosed with portal hypertension, which nursing diagnosis should be considered the highest priority. They didn't address fluids. They have to address it in the question for you to answer it. Do you see fluids?
No.
Alright. So now, ineffective individual coping, they didn't tell me the patient was confused. If they tell me in the question the patient was confused, I will take that answer, ineffective individual coping. Do you guys understand? Read the third question.
Okay. A client has been transferred back to the medical surgical unit after undergoing a segmental lung resuction. Following the initial assessment, what should the nurse's first action? What should be the nurse's first action?
Okay, you read the question. I want you to tell me what you understand. Because the way you read it, I don't understand it. What, hello, do not look at the question again. What did they tell you about this question? What's the story behind it?
They want to know
They want to know?
they're asking you
Before they know what they explain to you.
what is the priority
Priority of what?
in the care of the client.
Darling, what care? I don't know what the patient is there for. Read the question again.
Okay. A client.
Let me read it for you. A client has been transferring back to the medical surgical unit after undergoing a segmental lung resections. Following the initial assessment, what should the nurse first actions? Okay, first of all, Debbie,
Yes.
you understand the question, right?
Yes.
What is it? What's the problem of the patient? What's the problem of the patient, Debbie?
Okay, well, the person was transferred back to med-surg
Why?
from the segment.
Why?
Lungs segment.
That means you don't need to know anything. You just need to know they talk about the lungs, the patient have a surgery on the lungs.
Yes.
What the lungs is for?
Is for breathing.
Breathing. So now, read it one more time.
A client has been transferred back to the medical surgical unit after undergoing a segmental lung resection. Following the initial assessment, what should the nurse's first action be?
Read the question one more time to yourself to see if you understand it. Read it one more time.
A client has been transferred back to the medical surgical unit after undergoing a segmental lung resection. Following the initial assessment, what should be the nurse's first action? A.
No?
Oh,
Do you know what is a lung resection?
like when they cut part of the lung to take out something that's
Yeah.
affected.
Okay, that's the lung resection. Okay, go ahead.
I can read the answers now?
Yeah.
Okay. A. Altered nutrition, less than body requirements.
Mm-hmm.
B. Potential complication. Wait, I'm reading the wrong thing. Okay. Sorry, that was the wrong answer. A. Administer pain medication. That's A.
What was A? What was A, Jounen?
Administer pain medication.
Okay, thank you.
Uh-huh.
B. Suction excessive tracheobronchial secretion.
Mm-hmm.
C. Assist the client to turn, deep breathe, and cough. D. Monitor oxygen saturation.
Uh-huh. So I want you to read the question one more time and read the answer one more time so Debbie don't have the copy in front of her so she could know where to go.
Okay. A client has been transferred back to the medical surgical unit after undergoing a segmental lung resection. Following the initial assessment, what should the nurse's first action be? A. Administer pain medication. B. Suction excessive tracheobronchial secretions. C. Assist client to turn, deep breathe, and cough. D. Monitor oxygen saturation.
Okay. What is your answer, my dear? Not you, Debbie.
I pick D.
Thank you. What is your answer, Debbie?
B.
Debbie, you ready to take the exam, you know that?
What?
That's B. Because it's the lung. The lung has to be clear. It has to be clear of fluids, clear of secretion for you to breathe, to exchange, for you to have a good gas exchange.
Oh, I said action.
Okay, darling,
That's
please.
why.
It's not an action. It's okay. What do you understand? Debbie, explain to me what do you understand the question. You understand? A client, listen to me. A client has been transferred back to the medical surgical unit after undergoing a segmental lung resection. Your lungs allow you to breathe, darling. He has to be patent. He has to be free of fluids. He has to be free of clogging, clog. So you gotta maintain a patent that way. Administer medication for what? Did they tell you in the question the patient was in pain? No. Demonitor oxygen, did they tell you the patient's saturation is low? No.
Okay.
You gotta answer the question based on what they're asking you on the question. Next.
Okay. What playroom activities would be most appropriate for the nurse to plan for a small group of hospitalized 7-year-old children?
So now, that's only the question. 7-year-old. Now you need to go back to what category of people to look. Is it Maslow or is it Erickson? That's Erickson. So go to your Erickson because the last time I told you guys to study your Erickson. Did you guys do?
Oh,
Yes, I did.
I remember, yes, you did. I looked at it.
Okay, we're gonna leave it. If you don't study it, I'm gonna leave it. Next question.
Okay. 5. Oh, liver. Liver. So,
Hold on. If you know how to do question, even if you don't know the answer, you should be able to come up with the right answer. Okay, what question you have?
that was number 4.
5 now. We're gonna skip 4. 5.
Okay. A client with liver cirrhosis and ascites is under nursing care. When providing instructions to the nursing assistant, what key point should the nurse emphasize about the client's care?
Now, Debbie,
Yes.
what would you like to underline?
Okay. Liver,
Liver cirrhosis. Period. Aside this, we just learned about liver. What is the role of liver, Debbie?
to metabolism.
Metabolize what? Ammonia to urea and what else?
Yes.
Detoxifies
Detoxify, yes.
And-
And filtration.
filtration. So, and the clotting factors is responsible. The liver store glucose when you are in need. It processes glucose. When you are in need, it releases the glucose. It also detoxify the body from toxin, from which is the ammonia. It convert them to urea. If the liver fail to convert the ammonia to urea, the patient will become confused. So, and also is responsible for the clotting factors. It's very vascular. If the liver cannot store the clotting factor properly, the patient will bleed to death. Let's go. So now, read the question one more time.
A client with liver cirrhosis and ascites is under nursing care. When providing instructions to the nursing assistant, what key point should the nurse emphasize about the client's care?
Okay. A, give the answers. Let's go.
A. Should remain on bed rest in semi-Fowler's position. B. Should alternate ambulation with bed rest with legs elevated. C. May ambulate and sit in a chair as tolerated.
Okay, what is your answer, my dear?
Oh, there's one more.
What is it?
There's one more answer.
Good.
D. May ambulate as tolerated and remain in semi-Fowler position in bed.
What's the answer? I'm asking her, not you, baby.
So, C.
Debbie, what's your answer?
A.
So I want you to read the question one more time, please.
Okay. A client with liver cirrhosis and ascites is under nursing care. When providing instructions to the nursing assistant, what key point should the nurse emphasize about the client's care? A. Should remain on bed rest in a semi-phallus position. B. Should alternate ambulation with bed rest with legs elevated. C. May ambulate and sit in the chair as tolerated. D. May ambulate as tolerated and remain in high semi-phallus position in bed.
Answer, anybody want to change the answer? No?
D. D.
You change. Okay, hold on. Okay. Read the question one more time, please.
A client with liver cirrhosis and ascites is under nursing care. When providing instructions to the nursing assistant, what key point should the nurse emphasize about the client's care? A. Should remain on bed rest in a semi-phallus position. B. Should alternate ambulation with bed rest with legs elevated. C. May ambulate and sit in chair as tolerated. D. May ambulate as tolerated and remain in semi-phallus position in bed. I'm gonna pick B.
B?
Yeah.
Why?
Because
Not I'm gonna say hold on. What is your answer? We still stand with what?
D.
Why B?
I didn't really hear I picked A before because I didn't hear the answer as well, but I'm going to go with D.
D or B?
D. D. D
Like-
as dog. D.
Okay. So now, you take one answer? What is your answer? B. So now, go back to the rationalizations for the liver. The liver do detoxifications, store clotting factors, glucose management, then get rid of toxin, which is your ammonia converted to urea. So, if the liver does all this, and you know the liver causes ascites, accumulation of fluids in the abdomen, when the abdomen is full, the fluids will go in your lower extremities. So what do you think is the best management? It's not rest and elevate the lower extremities. When you elevate the lower extremities, the fluids will flow back to the lymphatic system and will find this way out. You're right, it's B. The reason is not D because they didn't address D. They didn't address D. I'm going to tell you why. I'm going to tell you why. I'm looking for the answers. D said, may ambulate as tolerated and remain in semi-phallus position. Do you have a doctor's order up there for that? No. He has to, you know what? You need a doctor's order, my love. You understand? Are you there, Debbie?
Yes,
You don't have a doctor's order in the question. Did they say the doctor was present? It's not there. If the doctor was there, maybe you could say, may ambulate as tolerated, but that's his order. And remain in semi-phallus position. No, you cannot be in semi-phallus position. It's not the lungs, there's extremities. It would be in toutlemonde position. You understand? Next question.
All right. When counseling an adolescent client.
No, forget it. Next.
Next one.
Mm-hmm.
During an interview with a client in the 3rd month of her first pregnancy, she reports having multiple.
Move next.
Oh, next one? Okay. When the nurse enters the room and observes the 3-year-old.
No, next 10.
Okay. 10?
Mm-hmm.
Okay. A client is diagnosed with thrombophlebitis in the left leg.
Darling, go back. The client?
A client is diagnosed with thrombophlebitis.
Okay. All right, good.
In the left leg. Which nursing intervention should take top priority?
What is thrombophlebitis? You got to look it up. Long thrombophlebitis and clex. If you don't know something, let me tell you, the Board of Nursing is not giving it to you for free. Mm-hmm. Thrombophlebitis. I'm so sorry. What is thrombophlebitis? It's not inflammation of the veins.
Mm-hmm.
Yeah, it's not in here. You gotta look it up.
Okay.
For the NCLEX, understand that thrombophlebitis is an inflammation of a vein, often caused by a blood clot, thrombus.
That's it. Thrombophlebitis is your vein. Hold on, darling, do not write until I finish explaining to you. Thrombophlebitis is a vein that inflamed. What causes the inflammations is a blood clot, usually that impedes circulations.
Okay.
Now you could read it again.
Thrombophlebitis is an inflammation of the vein, often caused by a blood clot.
You see the way you're learning, darling, it's not gonna work. I told you to read it first again before you start writing. You could stick dans tête ou pour écrire. Là écrit, là arrive la carouette. Est-ce qu'on bien t'avoir étudié, yes or no? Okay. Whatever.
No, that's true.
That's you.
Thrombophlebitis is an inflammation of the vein. It's caused by a blood clot.
Qui ça qui cause thrombophlebitis? Son blood clot, son sang caillé dans veine. Puisque sang caillé dans veine, ou pas vle déplacer, that means you know now you impede the flow of circulation. Circulation has two things to do. It's either it goes down to the lower extremities or it go up. Up dangerous, the lungs, the heart attack. Oh my. Okay, let's go.
Definition: inflammation of a vein with a blood clot. Thrombus. A blood clot is called a thrombus.
You just need to know blood clots is thrombus. That's it.
Okay. So, a client is diagnosed with thrombophlebitis in the left leg. Which nursing intervention should take top priority? A.
So now, where is the thrombus? Which is the blood clot? Where is it?
Left leg.
Okay. Where is in your left? What is in your left side in your body?
Lungs.
Your heart.
Your
You have
heart.
two lungs, darling. One on the left, one on the right. Your heart is on the left side.
Yes. Sorry. Yes, that's true.
Okay.
Okay. Elevate the leg on two.
Darling, read the question again because we were back debating. I don't think you remember what they were asking you now.
No. Okay. They said which intervention should.
Darling, read the question again so you could know where they're going with you.
A client is diagnosed with thrombophlebitis in the left leg. Which nursing intervention should take top priority? A. Elevate the leg on two pillows. B. Apply support stocking. C. Apply warm compresses. D. Maintain the complete bed rest.
Okay. So now, what is your answer, Debbie?
B.
What is your answer, my love?
B.
Read the question again.
A client is diagnosed with thrombophlebitis in the left leg. Which nursing intervention should take top priority? I changed my answer.
Darling, please read the question and give all the answers.
Oh, okay, I'm sorry.
Read the question.
Okay. A client is diagnosed with thrombophlebitis in the left leg. Which nursing intervention should take top priority? A. Elevate the leg on two pillows. B. Apply support stockings. C. Apply warm compresses. D. Maintain complete bed rest.
Debbie, what's your answer?
B.
What's your answer?
B.
What is your answer, my love?
A.
A is the answer. You know why? Let's read the question again and I'm going to tell you why.
A client is diagnosed with thrombophlebitis in the left leg. Which nursing intervention should take top priority? A. Elevate the leg on two pillows. B. Apply support stocking. C.
Hello, without the doctor, can you apply support stocking?
No.
Did they address the doctor in the question?
No.
No. Continue.
Apply warm compresses.
No, C. Go by your letter, please.
C. Apply warm compresses.
Anything you are applying, you need a doctor's order. Do you see the doctor's order? Do you see it in the question?
No.
Okay, keep on going.
D. Maintain complete bed rest.
Only the doctor could tell you the patient is in bed rest, okay? So that means the only answer you have valuable for you now is the A. Next question, please.
A child has just returned from surgery after a tonsillectomy and an adenodectomy. Which
Darling, read the question again. Take your time. Because when you change the name of the diagnosis, it's not going to work.
a child has just returned from surgery after a tonsillectomy and an adenoidectomy. Which nursing action would be most appropriate?
Okay. Debbie, can you explain to me what did you understand about this question?
Okay, it says that the child has returned from a tonsillectomy and an adenectomy.
What is adenectomy? We know tonsillectomy is removal of the tonsil. What is adenectomy? Please look it up.
Yes.
Isn't it that adrenal?
Darling, please look it up. There's no butter Eve. Darling, please make sure you put in clicks and let me know where.
Okay.
Adenoidectomy. Where is your adenoid to begin with? It's not in your. Look it up. Where is it? Your adenoid. They do an adenoid. Where is your adenoid? That's one thing you need to know.
Why am I not finding it?
In the back of the nasal cavity.
Okay, so put it so you know it. It's nasal cavity. When they're talking about the nasal, what do you see?
The nose.
What do you see? You don't see respiration?
Oh yeah, that's right.
Mm-hmm.
What do you mean the nose? Everybody gonna have a nose.
Okay. For Anntwip's key nursing considerations for a patient undergoing an adenectomy, often performed with a tonsillectomy, focus heavily on airway management, preventing hemorrhage, and ensuring adequate hydration. Did you find it, Debbie? Because mine is just giving nursing.
I didn't know adectomy. It's not on your ears, no? It's on the back of the.
This is a surgical removal of the adenoid tissue located at the back of the.
That's all you need to know. That's all you need to know. That's all you need to know, darling. You're not a doctor. Just write it. You know where it is. Adenoidectomy is the removal of the adenoid. So that's the way to study. If you don't study that way, it's not gonna work.
Okay. You said, can you repeat what you said, Debbie? The removal of the adenoid.
Yeah, removal of the adenoid tissue located at the back of the nasal cavity.
Okay, so your nose is responsible for intake of air. You gotta breathe the air and the oxygen, and for you to, have and the air need to go through the pathway of respiration. You know, right? Okay, so now based on that, now you know it's something that has to do with your nasal.
Mm-hmm.
So now read the question again.
A child has just returned from surgery after a tonsillectomy and an adenodectomy. Which nursing action would be most appropriate? A. Offer ice cream every 2 hours. B. Place the child in the supine position. C. Allow the child to drink through a straw. D. Observe swallowing patterns.
That was your read the question one more time.
A child has just returned from surgery after a tonsillectomy and an adenodectomy. Which nursing action would be most appropriate? A. Offer ice cream every 2 hours. B. Place the child in a supine position. C. Allow the child to drink through a straw. D. Observe the swallowing pattern.
What will be your answer, Debbie? If you want to read it again, read it again.
D?
What would, do you want to read it again or not? That's what I'm asking.
The question?
Yeah, you want me to read it again?
Okay. So now you know what is adenoidectomy. Okay. So now, what's your answer? You said your answer is B?
No, she said D.
Leo, what's your answer?
I said B.
Okay. Why B?
Well,
Why is Z? Read the question again for me.
a child has just returned from surgery after a tonsillectomy and an adenodectomy. Which nursing action would be most appropriate? A. Offer ice cream every 2 hours.
Okay, did the doctor told you the patient could eat?
No.
And the question?
No.
B, let's go with B.
Place the child in supine position.
Go to C.
Allow the child to drink through a straw.
Did the doctor told you the patient could drink again?
No.
And the question? Continue.
Observe the swallowing patterns.
What is what's that D?
Yeah.
What is your answer, Debbie? What was the answer for Debbie? No. What was the answer before?
What did you think before?
What was your answer before, Debbie?
No, my answer was always D. Observe swallowing a pattern.
Why?
Because that's a sign that if the child is still bleeding.
That's it. That's the answer. What was the answer right here?
My answer was B.
Why B?
Because
Why B, darling? Tell me what is the answer. What is B answer?
I thought that was the position.
What is your B answer, darling? That's what I want to know. What is B?
Oh, place the child in supine.
You don't have that business.
Oh,
They're not asking. Supine. What is supine to you? Face down? That's supine? You want to put somebody who has surgery in a supine position?
No.
You need to know your position. Now your job tonight to look all the positions.
Okay.
Chandelier position, supine position, high fowler, low fowler, semi fowler. You gotta look them. You gotta know your position.
Okay.
You know? If you don't know your position, all you're gonna do, you put somebody on supine, he's gonna die. Suffocated.
Oh, supine on the face. Okay.
Okay.
I messed up. All right. So observe the swallow patterns.
Of course, because you know if you keep on swallowing, frequent swallowing, indicating bleeding.
Okay.
The people not granted, indicating bleeding. The people not gratte gorgery après surgery, say bleeding. They call it the granted. Frequent swallowing, frequent monapman de boule craché is increased bleeding.
Okay.
Okay. Keep on going. Next question. So now, let's go back to that question. Go back to that question again. You gotta know what they're asking you in the question. The answer is in the question. If they don't ask you for something, you do not address it. You're not the doctor, you know your scope. So read the question again.
A child has just returned from surgery after tonsillectomy and adenodectomy. Which nursing action?
Adenodectomy, qui kote liye?
Behind the nasal.
Behind the nasal. What qui sont utilisés nerf pour faire? Breathing. If the adeno, you for mistake, you coupe un bagage passe la bleed, moun n'a pas ka breathe. Let's go.
Which nursing action would be most appropriate? A. Offer ice cream every 2 hours.
Kid wow. And back in the question. The doctor was present? Are they talking about nutrition?
No.
Okay.
Place the child in the soup.
B, Sherry, B. Jenny.
Place the child
Lop,
in the
okay.
position.
Supine position is you really plané. Lop plané. Ou pas qu'à planer. Sous planer, faut être tout à virer à gauche ou à droite, qu'est-ce que tu dis ça là?
No.
Moun sa moun tout fait avec ça.
Okay, this is not the right answer. Apply the child. C. Apply the child and allow the child to drink through a straw. No.
No, why? We're not allowing you to a straw. Why?
The doctor didn't order it.
Dans le docteur va besoin de straw. When you apply the straw, qui sont utilisés? Your muscles, guess what? You're pressing the muscles to release more blood.
Okay. D. Observe swallowing patterns.
Si moun n'a pas de valer, mes amis, il va gagner liquide dans la bouche, il va signer l'absent. Si moun n'a pas de gratte gorge, il va signer l'absent. Si moun n'a pas de cracher, il va signer l'absent. Mais go mon sou. Let's go next.
$12. When planning care for a client with pneumonia, which intervention would be most effective for promoting?
Chérie, li bagay la avec sens pour comprendre ni pour l'autre moun kapte nou lan komone, ça me pede do.
Alright, let me start over. When planning care for a client with pneumococcal pneumonia, which intervention would be most effective for promoting the removal of respiratory secretions? You want me to read it one more time?
That's up to you. Do you understand what you read?
Let me read it one more time. When planning care for a client with pneumococcal pneumonia, which intervention would be most effective for promoting the removal of respiratory secretion?
What do you understand, Nasolian chérie? Qui ça ou do basan gen?
Pneumonia.
Qui ça ou di yo besoin faire pour lui?
Removal of the respiratory secretion.
Okay. Read it one more time and goes to the question and says now wait.
Okay. When planning care for a client with pneumococcal pneumonia, which intervention would be most effective for promoting the removal of respiratory secretion? So they're asking for an intervention that's most effective.
Okay, go ahead and read the answers.
A. Administration of cough suppressant. B. Increasing oral fluid intake. B. Increasing oral fluid intake to 3,000 cc per day. C. Maintaining bed rest and bathroom privileges. D. Performing chest physiotherapy twice a day. I picked D.
What is your answer, my love?
Yes, D.
What is D?
Performing chest physiotherapy twice a day.
Do you know chest physiotherapy need to be ordered because you could damage your organ by a doctor?
Yes.
Do you see that in the questions?
No.
Do you see the doctor orders? Did the doctor order it in the question?
No.
Okay, go back and look at the question. Everything that the doctor did not order, you cannot pick it.
Okay. All right, let me read it again.
So D.
Yeah. When planning care for a client with pneumococcal pneumonia, which intervention would be most effective for promoting the removal of respiratory secretions? A. Administration of cough suppressants.
Did you see the other cough question? Did the other cough question? Okay.
Increasing oral fluid intake at 3,000 cc per day. No.
Mm-hmm.
Maintaining bed rest with bathroom privileges. D. Performing chest physiotherapy twice a day.
What is your answer?
C.
What is
D as boy.
what is B?
Increasing oral.
Increase fluid intake.
Yes, because in the lungs, sometimes mucus is plugged. For you to loosen mucus, if it's not contraindicated, you need fluids. You're right.
Oh, okay.
I'm going to leave it this way now because you guys need to understand. Okay, so now read the question one more time.
When planning care for a client with pneumococcal pneumonia, which intervention would be most effective for promoting the removal of respiratory secretions? A. Administration of cough suppressants. You need a doctor's order for that, so no. Increasing oral fluid intake to 3,000 cc per day. C. Maintaining bed rest and bathroom privileges.
The doctor did not, he didn't ask for that.
Performing chest physiotherapy twice a day.
Physiotherapy, you need the doctor's order because you could damage your organ.
Okay. So it's B. Increasing oral.
That's it. Mucus plug, this is picket away you want to maintain. They didn't tell you the patient was contraindicated to get fluids, no?
No.
Okay, I'm going to keep it this way. I'm going to stop here.
Okay, Marie.
Listen, I want you guys to do questions tonight. And do not look at the answers.
Okay.
That's on you. If you want to look it up.
No. So just continue with this packet.
Yes. And then debate everything you don't know, put a note next to it.
Okay. So this one's for me. What about Crystal?
Hers is here whenever she comes. You want to take it too? Take it.
Oh, so I'll mail it to everybody.
Yeah, take it.
Okay. All right.
So after you do this, if you understand the concept and now you do the pictures and the cardiac, you're good to go.
Okay.
Yeah, but you have to understand.
Thank you.
Okay,
So next Sunday?
Sunday. After this Sunday, I'm not going to be available.
So after next Sunday, you're not going to be available, then we're coming back the following.
Yes, and then after that, everybody could get their date to take the exam.
Okay.